Hi, this is Dr. Joe Feuerstein with the MD Minute. Thanks for tuning in today. Studies coming out of the University of Washington looking at research on a reduction in the risk of breast cancer through lifestyle changes, almost a 50% reduction in breast cancer incidence in both women before and after menopause. So this is very interesting. We know that, for example, heart disease, a lot of research is done looking at how to reduce the risk of getting heart disease. And the same thing holds true for infections. But it turns out you can look at the evidence and you can see that there's actually a reduced risk of developing breast cancer. You can reduce it by up to 50%, which is huge. Just thinking about lifestyle, why is it that Asian women have a lower incidence of breast cancer until they move to the United States, to California or Hawaii, and suddenly their risk of breast cancer goes up? That's because lifestyle has an enormous influence on breast cancer risk, both in women before and after menopause. So in terms of the actual risk factors, number one is weight. You want to keep a normal weight. The heavier you are, the more fat you have, the more tissues in your body, the fat tissues, turn your testosterone, your hormone that you make, into estrogen, and estrogen is a thing that will develop your incidence of breast cancer, will go up with too much estrogen. Smoking, obviously, is something we all know about. Just in terms of exercise, we're looking at a 30 to 60 minutes of aerobic activity on most days of the week, significant breast cancer reduction gains. Alcohol. Turns out that for every drink you have every day as a woman, your risk every day is increased by 10%. So what you're looking at is drinking every single day increases your risk of breast cancer by 70%, which is huge. Unfortunately, the way it works in terms of breast cancer is that you really want to be drinking infrequently, possibly once or twice a week, to get the health benefits from the heart without the benefits, without increasing the risk from breast cancer. Some people have these genetic tendencies to breast cancer. There's a family history, and specifically if you contain a gene or you carry a gene called BRCA, and the BRCA gene puts you at a massively increased risk of breast cancer in both breast and also in the ovaries. There are surgeries. There's also medication that we use under those circumstances. Again, integrative medicine is not shy away from Western medicine. We use it when appropriate and when these studies have shown that it can be of benefit. And finally, in postmenopausal women, there's definitely a link between hormone replacement therapy and breast cancer. So this is a discussion you want to have with your physician. In summary, breast cancer is modifiable. There are many things that you can do, and you should look at each one of these things and make sure that you're getting a tick and not a cross. And that way, we're going to all be healthier, thinner, and less likely to get breast cancer. Dr. Joe Feuerstein with the MD Minute. Thanks for tuning in.